Jim, people say we already spend a lot on health care.
We spend an enormous amount on health care. We spend $2.6 trillion a year and going up steadily. And remember, all of these cuts that the politicians are talking about in the future growth of entitlements, the Pete Peterson effort and the Bowles-Simpson Commission and whatever other budget agreements are coming fall pretty heavily in terms of budgetary knives on Medicare and Medicaid. There's a presumption somewhere that these geniuses in Washington are going to figure out how to cut Medicare in the year 2030 or 2040 or 2050 and so on. And having been in Washington myself since 1980, having come here more than 3 decades ago, I can tell you that political inspired cuts on Medicare and entitlements in general are extremely unpopular. You're going to an old and vulnerable and weak and physically ill population oftentimes, and then saying we're going to cut the one thing that you really think you need. Well, guess what? The voters don't agree with this. Just because the elites in this town are convinced that the only way out of our crisis to avoid becoming Greece is to cut these future entitlements, the voters, little old ladies in Steubenville, Ohio, don't necessarily agree. In fact, it's been pretty proven that they don't. By a factor of 3 or 4 to 1, the American people, not just the elderly population, would much prefer to see a substantial tax increase than to see Medicare and Medicaid cut. Now, it may happen anyway, in which case I suspect we'll just see a lot of incumbent politicians losing. But here's the bottom line that I would say to both Peter Orszag, who was President Obama's OMB director and a former Congressional Budget Office director before that, and a well-known maven in healthcare, and also say Paul Ryan, the Republican congressman from Wisconsin on the right. I say, look, if Alzheimer's, which currently afflicts 6 million people and has as a current 2010, according to the Alzheimer's Association, cost of $172 billion a year. Now, most of that being Medicare and Medicaid outlays, as Alzheimer's quadruples over the next few decades, as baby boomers and everyone else get older, the cumulative cost of Alzheimer's care is going to hit $20 trillion, with a T, trillion dollars by mid-century. Again, that will, if current trends are continue, that will be entirely futile care. It will be no element of cure and treatment and rehabilitation. It will simply be millions and millions of people warehoused, suffering from dementia and needing 24/7 care across the country.
Therefore, the only choice is?
The only truly humanitarian choice, the only truly smart choice is to have a crash program on curing Alzheimer's, engaging not only the private sector, the public sector, the independent sector, but also substantial regulatory and reform and political leadership, and peeling back the trial errors to make it so overwhelmingly popular with investors and scientists that this is what they want to focus on.
Jim, if you were king on this Alzheimer's disease process, what would it look like?
Here's a good example of how I think we could approach Alzheimer's. And I'll tell it in the form of a story. Three years ago, I was talking to a member of Congress, who was opposed to a Republican, who was opposed to President Obama's health care plan, the health insurance plan. So we were yakking away, and I said to him, now listen, suppose President Obama got up in the middle of this debate over health insurance. He got up on TV tomorrow from the White House and said, I've just met with 50 winners of Nobel Prizes in medicine, and 50 philanthropists, and 50 hedge fund moguls, and 50 deans of medical schools, and Bill Gates and Bono and whoever else. And I've enlisted the sovereign wealth fund of Kuwait and Chinese billionaires and Indian billionaires and so on. And they tell me that if we create some sort of enterprise zone, maybe not just necessarily in one physical place, but around the world, and we have real limitations on what the trial lawyers can do, like immunity from liability, and we have FDA streamlining and prizes for success in this and so on. I said, and if we do all that, there's no guarantee, but based on what we accomplished with polio and AIDS and a few other diseases, including yellow fever and malaria way back when, using different technology and public hygiene in the cities and so on, there's real chance, folks, that we could cure Alzheimer's in 10 years or make a big dent in Alzheimer's in 10 years. And so I said to this member of Congress, I said, if the president proposed this, would you vote for it? He said, sure. I said, how many of your colleagues in the House of Representatives do you think would vote for it? He said, 382. I said, so it's a good idea, right? He said, yeah. I said, so why don't you propose it? And he just looked at me because everybody knows that the rule of Washington is that if you're a Republican member of Congress, you oppose Democrats. And if you're a Democratic member of Congress, you oppose Republicans. And so the idea of actually coming together, actually joining together in some effort based not on sort of a namby-pamby pretending we don't have differences, because we do, but a realization that there's a sort of a highest common denominator of problem solving. So if we did do all those things, we did regulatory reform, we did tort reform, we provided real incentives, X prizes like was what got us into space, or the government and of the United States and maybe other countries saying, look, if you make an Alzheimer's cure, we'll buy it. We guarantee your market now. I think you'd see, venture capital and investors and scientists rushing to solve the problem. I can't think of any other way to do it, and this is what's happened in the past. It worked before, it could work again. And this is how serious medicine could change the lives of Americans and people around the world in the 21st century.